Hi, my name is Gemma Yang, Associate Professor at the Department of Sport, Physical Education and Health, Associate Director of the Center for Exercise Science and Health Research. Taking this opportunity, I'm going to talk about my research in physical activity and health. It's a matter for everyone in the world. Let me start this presentation with a brief self-introduction. Before joining the department, I'd been trained and worked in medicine and public health. I've been proactively involved in research on physical activity and health for many years. And currently, my research has been focused on health promotion in diverse populations, physical activity-related injuries, exercise rehabilitation for discharged patients with COVID-19, and the role of gut microbiota in exercise-induced health benefits. You're welcome to scan the QR code of my webpage to get more information of me. Here's a summary of my research output. Up to now, I got 21 grants and published more than 100 papers. The figure shows the statistics of citations and indexes of my publications by February 2021. The number of overall citations is more than 4,000, and that of the item index is about 40. I have accounts in Google Scholar, ResearchGate, and ORCID. Those links are provided on my webpage. You're welcome to add me and follow me. I'm a PhD supervisor at the department and currently supervise 2 full-time students. If you are interested in pursuing a PhD with my supervision, you are strongly suggested to scan the QR codes to know more about the procedures and the requirements of admission, and contact me by email or WeChat. In this presentation, I'd like to introduce a COVID-19 rehabilitation program which I'm involved in. COVID-19 is a new infectious disease caused by severe acute respiratory symptoms, coronavirus 2. It's first found in Wuhan, China, in the December of 2019 and rapidly spread out over the world and caused huge impacts on many aspects of the human society. By the 18th of February 2022, there are more than 100 million confirmed cases and 2.5 million deaths in the world. By the same date, there are 10,000 confirmed cases and near 200 deaths in Hong Kong. It's been reported the clinical symptoms and signs of COVID-19 can last months and even longer. For example, 87% of discharged patients still suffered from at least one relevant symptoms 2 months later, and the figure was still kept at 74% even at the 4th month after discharge from hospitals. The major long-term consequences include common symptoms such as fatigue, shortness, and headache, impaired functions such as lung function, fitness level, metabolic function, and immune function. In addition, mental problems, which secondary to COVID-19 are also very prevalent, such as loneliness, depression, and anxiety. It's expected that the rehabilitation would help the patients recover from the continued symptoms. So the overall aim of the project is to develop a new paradigm which combines tele-exercise with Chinese herbal medicine to help discharge the patients with COVID-19 who are still suffering from relevant symptoms and signs to recover. Specifically, we are to evaluate effects on reducing continuous symptoms and improving functional capacity, to evaluate effects on improving mental considers and health-related quality of life, and to reveal mechanisms involved in the effects observed. In particular, to study whether and how the gut microbiota plays a role in the above-mentioned intervention-induced health benefits. The program would generate the following impacts. It's a beneficial and efficient rehabilitation for many patients with COVID-19. It releases heavy burden on current healthcare system. It's the first attempt to build up a clinically validated rehabilitation program, and its success will have a significant impact to the world in the battle with COVID-19 and other new emergent diseases. We have a strong international research team consisting of world-class scientists and healthcare professionals with interdisciplinary expertise, such as Professors Peter Waggin and Julian Baker from the field of exercise science, Professor Zhao Xiangbian and Wei Jia from the field of Chinese medicine, and Professor Yike Guo from the computer science. The program is a 12-week randomized control trial with 4 groups. Target population is discharged COVID-19 adult patients without pregnant and be able to do exercise. There are 2 intervention components, tele-exercise and Chinese herbal medicine. We'll recruit about 200 patients, randomly and equally assign them into 4 study groups, including a combined intervention group of the tele-exercise and Chinese herbal medicine, a tele-exercise intervention group, a Chinese herbal medicine intervention group, and a wishlist control group. The tele-exercise intervention is a novel approach for rehabilitation, characterized by a set of live online, home-based, simple, and personally tailored exercise sessions. Participants will receive a 40 to 60 minutes tele-exercise session 3 times per week for 12 weeks. Each section will consist of both aerobic and resistance exercise and supervised by coaches. In addition, participants will perform additional inspiratory muscle training to reach the required dose of twice per week for every day. We'll also provide 12 counseling sections to the participants to encourage them to do more exercise based on behavior change theories and techniques. In terms of the Chinese herbal medicine, the modified Baidu Gujing granules will be prescribed to improve participants' qi and yin with a dose of 5 grams per time, twice per day for every day. Outcomes measured include the primary outcome of lung function and fatigue, as well as exercise capacity, mental health, and other clinical symptoms. We also collect blood, urine, and fecal samples to test their immune function, inflammation function, and gut microbiota to reveal the underpinning mechanisms of the health benefits. This figure shows the timeline of the program. After the first wave of measurements at the baseline, participants will receive a 12-week intervention. After the second round of data collection, they will be followed up for 12 weeks, followed by the last wave of assessment. We adopt a waitlist control design, so after the main study, participants in the control group will receive the same 12-week intervention to help them recover. The program is still ongoing. Here are some pictures taken in the field work. And this slide shows the photos of the press conference and some media reports of the program. You may find more information of the program by scanning the QR code. We are still recruiting participants for the main study. We need your kind support by disseminating our program to your friends. We very much appreciate. Thank you for your watching. Please don't hesitate to contact me if you are interested in my research. Let's work together to make the world a better place.